Managing a chronic condition like chronic obstructive pulmonary disease, COPD, it can feel like this constant uphill battle, can it? It's often like walking a tightrope. One little wobble, and you're looking at hospital visits, high costs, and just a lower quality of life because of those respiratory exacerbations. It's a huge weight. But what if technology could kind of offer a safety net? Bring care right into the home. That's really the idea behind home telemonitoring. It sounds maybe a bit futuristic, but it actually goes back to the early 90s. The core concept is pretty simple. Empower patients, improve how they interact with their doctors and nurses, and hopefully prevent those unplanned hospital stays. How? By using tech to send health data, oxygen levels, vital signs, symptoms straight from their home to a healthcare center. Now, lots of research has looked at, say, clinical outcomes or the economics of it all. But today, we're taking a slightly different angle in this deep dive. We're focusing on how the methodology is used and, really importantly, the human side, patient adherence and satisfaction.
Exactly, because understanding not just if it works in theory, but how it's actually put into practice and what patients really go through using it. That's absolutely key. That's how we design better solutions down the road. This deep dive is about getting into those nuances, the real-world stuff that makes or breaks these systems.
Right. So before we get into the patient experience side, let's paint a picture. What did this home telemonitoring actually look like for someone with COPD? Was it complex gear?
Well, it was quite a mix, actually. The review we're drawing from found a pretty diverse range of technologies. The main units were often things like mobile phones or web phones with touch screens, sometimes even dedicated touchscreen computers.
Okay.
And these main devices connected to various peripherals, things you'd expect like oximeters for oxygen saturation, spirometers for lung function, blood pressure monitors, thermometers. Some systems were quite advanced, including electrocardiographs, respiratory rate sensors, even electronic stethoscopes.
Wow, quite comprehensive then.
Yeah, some really aim to capture a lot. And some systems even push out information to the patient disease info or educational questions right on the screen.
So you've got this central device, various sensors. How did the data actually get from the patient's living room to the clinic? Was it automatic, or did patients have to manually punch things in?
Good question. It seems it varied. Symptoms, answers to self-management questions, that stuff was often manually entered using the touch screens. What's a bit less clear from the studies is whether the clinical data, from the oximeter or spirometer was always automatically sent across, or if sometimes patients had to type those numbers in too.
Which could be a hurdle.
Definitely. And the transmission itself. Typically done daily, usually over a standard phone line to a secure server. Sometimes it was real-time, other times it was like, okay, transmit at 8 a.m. every day. And that data was then monitored daily by healthcare professionals, could be at the hospital, a call center, sometimes even a center run by the device manufacturer.
Okay, so data's collected, data's sent, someone's looking at it. But how did these systems actually, help? How did they go from just tracking to actually intervening or supporting? What was the safety net part?
Right, that's the crucial bit. The systems were designed to be proactive. Alerts were a big part of it. If readings fell outside certain preset limits, boom, an alert went automatically to the healthcare team or the researchers.
Okay, makes sense.
And if a patient just didn't send their data, they'd get contacted, maybe a phone call, maybe a message on the device screen. The systems also gave reminders, prompts to take measurements, reminders for medication, or even for breathing exercises like pursed lip breathing. And of course, those automatic alerts if readings were off.
And the human touch. How were patients trained to use all this? Was it like a tech boot camp?
Generally, it seems training happened during an initial home visit, usually by a nurse involved in the project. Some studies mention patients had to actually show they could use the system correctly. But here's an interesting point. Only one study specifically mentioned giving patients information about what normal clinical readings should look like during training and ongoing support. It seems it was mostly available just as required in only a couple of studies, which raises a question. Was that initial visit really enough?
That's a really critical point. If you're not totally confident, any little glitch feels huge, right?
Exactly.
So let's pivot to the user experience. What did all this mean for the people actually using these systems every day? Did they stick with it? Were they happy with it?
Well, adherence. It's a bit of a mixed bag. Some studies had really low dropout rates, which is great. But 5 studies reported pretty high dropout rates, like 20% or more, or had low compliance, meaning patients weren't using it consistently, maybe less than 80% of the time.
So not a slam dunk for everyone.
Definitely not. There were clearly obstacles.
And I think this is maybe the most fascinating part. The reasons why people struggled or stopped. It wasn't always just about their health getting worse, was it? It sounds like the tech sometimes tripped over basic human factors.
You've hit the nail on the head. The review really highlighted this disconnect. The high-tech promise sometimes stumbled on very practical, very human issues. Usability was a big one. Some devices were just too clunky to carry around, especially for people still working. Or the required frequency was too much. Imagine having to stop and do readings 3 times a day.
Yeah, that's demanding.
Then there were specific device problems, things like screens and text being too small, a real issue for older users, or those with vision problems. Touch screens could be tricky for people with, say, neuropathy affecting their fingers, or just poor fine motor control. Buttons too small. One study even mentioned the emergency call button was too sensitive.
Oh, dear. Accidental calls.
Presumably. And some mobile phones were just seen as far too technologically advanced, needing help from family or caregivers. Which kind of defeats the purpose of empowerment, doesn't it?
It really does.
Patients also had trouble figuring out exactly where to place sensors, or found things like a respiratory rate belt uncomfortable, especially if they were already short of breath. And beyond usability, just plain technical glitches. Batteries that didn't last long and took ages to charge.
Always the batteries.
Always. Small, fiddly power connections. Computer fans making too much noise in small apartments. Uncertainty about whether the data actually sent successfully, and limited portability for some devices. Of course, sometimes people stopped for health reasons, their condition worsened, they had an exacerbation, moved away, or sadly passed away. Those are unavoidable factors.
It really sounds like that Goldilocks issue with data frequency you mentioned, finding the just right amount. It's almost ironic, isn't it? You build this complex system, but asking someone to use it slightly too often becomes the breaking point. That one study is striking. Daily checks got 98% compliance, amazing, but 3 times a day. Compliance dropped to 79% for oxygen and only 60% for respiratory rate.
Yeah.
That's a huge fall off.
It's a massive difference. It just shows how easily inconvenience can undermine even the best intentions of the technology. But despite all these challenges, when you look at patient satisfaction, the picture is actually overall pretty positive.
Really? Even with the usability issues?
Yeah. Generally, patients reported being satisfied, finding the systems useful. Many studies said the tech was easy to learn and use, which seems maybe contradictory, but perhaps points to the underlying value they felt they were getting.
There's an interesting paradox. Difficult in some ways, but satisfying overall.
Yeah.
What was the core value then? What specific benefits did patients feel they were getting despite the frustrations?
I think the benefits really speak volumes. Patients felt they had better self-management. They understood their COPD better, their symptoms, how to control things. They felt more involved in their own care. They could spot signs of an exacerbation earlier, which is huge. They also felt the care they got from their healthcare team improved. But maybe the biggest driver of satisfaction, the thing that outweighed the hassles, it was this significant sense of security and reassurance. Just knowing someone was monitoring them, that they'd get a call if things started to go wrong, that was incredibly valuable.
Oh, that makes a lot of sense. Peace of mind.
Exactly. Plus, they felt communication with their doctors and nurses improved, and it was easier to get professional advice when they needed it.
Although it's interesting that one area where satisfaction wasn't as high was medication reminders. Patients often felt they already had that sorted.
Yeah, a small detail, but telling. It shows where the tech maybe wasn't adding value for their specific routine.
So pulling this all together, this deep dive shows that home telemonitoring has real promise for COPD, offering that vital security blanket.
Yeah.
But it also clearly shows it's still, relatively speaking, a new field. And there's quite a bit of room for improvement before it's ready for really widespread effective use for everyone.
Absolutely. And the review points towards some clear recommendations based on these findings. First off, more training. That single home visit, probably not enough for many people. The suggestion is maybe more sessions spread over a few days to really let patients get comfortable and learn how to use the system optimally, build that confidence.
Right, get past that initial learning curve properly.
Second, and this is crucial, patient-centric design. We really need to assess individual patient needs, their capabilities, their acceptance of tech before just handing them a device. It means designing tech that's genuinely easy to use, thinking specifically about potential disabilities, bigger buttons, clearer screens, simpler interfaces, designed for the person, not the spec sheet.
Make perfect sense.
Third, flexibility. We talked about the frequency issue. Data collection needs to be adaptable to patient preferences. Rigid schedules just don't work well for compliance. We still don't know the perfect frequency, honestly. That needs more research. One size definitely does not fit all here.
No, clearly not.
And finally, a point about how we measure success. Patient satisfaction was often measured using scales that weren't formally validated.
Ah, okay, so the measurement tools themselves might be a bit weak.
Potentially, yes. It means we need more robust, validated instruments or maybe more in-depth qualitative work like interviews to really get a reliable picture of patient satisfaction and use that to improve future designs.
It really drives home that point. The tech's success hangs entirely on how well it fits into the user's life and meets their actual needs. The human factor is everything. So, wrapping up, this deep dive has shown us both the huge potential of home telemonitoring for conditions like COPD, that sense of security, better self-management, it's powerful. But it's also starkly revealed how critical, thoughtful, human-centered design is. It's not just about having smart tech. It has to be usable, adaptable tech.
Precisely. It reminds us that the technology can be brilliant, but its real power only comes alive when it fits seamlessly into someone's life, when it serves them, rather than just being another task they have to manage. The how matters just as much as the what.
So here's a final thought for you, our listeners. As technology keeps racing ahead, how do we make sure these health solutions aren't just smart, but truly adaptable and intuitive for everyone? How do we ensure the benefits of being monitored always outweigh the burdens of actually doing the monitoring? What role do you think truly personalized, adaptable tech will play in shaping the future of healthcare right there in our homes?